Welcome to Dementia and Alzheimer's Disease, a family guide to understanding and advocacy. Structured across 8 modules: Introduction to Dementia and Alzheimer's, Recognizing Early Signs of Cognitive Decline, the Diagnostic Process, Understanding Disease Progression, Treatment and Management Options, Caregiving Fundamentals, Advocating for Your Loved One, and Living Well with Dementia. We've now covered the common early symptoms in Module 2 of Lesson 1. We've learned how they manifest. So now you may be wondering how to tell if these changes are part of normal aging or something more serious. In Lesson 2 of Module 2, we'll compare normal aging with dementia using practical tools and examples to help you make informed observations. In Lesson 2 of Module 2, we'll learn to distinguish between cognitive changes due to normal aging and those suggesting dementia. You'll understand typical age-related changes, identify red flags for more serious issues, and explore tools for tracking and discussing observations with family. This lesson will help you avoid unnecessary worry or delays in seeking help, ensuring you're prepared to act when needed. So let's begin. As we age, some cognitive changes are perfectly normal and don't indicate dementia. Occasional forgetfulness is common, like misplacing keys or forgetting a friend's name but recalling it later. For example, you might forget where you parked your car but retrace your steps and find it without issue. Slower processing speed is also another typical change. It may take longer to learn a new skill, like using a smartphone app, but with practice, you can still master it. Mild multitasking challenges are also normal. Needing more focus to juggle tasks like cooking while answering a phone call doesn't mean you're losing independence. Importantly, these changes don't significantly disrupt daily life. You can still drive, manage finances, or cook dinner without consistent problems. For instance, a 75-year-old might need a moment to recall a recipe, but still prepares it successfully. These changes are gradual, manageable, and part of the aging process for most people. So take a moment and reflect. Have you noticed these kinds of mild changes in yourself or your loved one? In contrast, dementia involves more severe and persistent symptoms that disrupt daily life. Persistent memory issues go beyond occasional forgetfulness. Someone might forget important information, like a doctor's appointment, and never recall it, even with reminders. Impaired reasoning is another warning sign, such as struggling to solve simple problems, like calculating a tip or planning a routine task like grocery shopping. Significant confusion, like losing track of dates, seasons, or family routines, is also concerning. For example, someone with dementia might not know it's Wednesday despite a calendar, or get lost in their own neighborhood. Loss of independence is a key differentiator. Dementia makes it hard to manage finances, medications, or self-care without help. Imagine someone who repeatedly forgets to take their medication or can't balance their checkbook, leading to missed bills. These signs indicate a need for evaluation, as they go far beyond normal aging. The key to distinguishing normal aging from dementia lies in the severity, frequency, and impact of symptoms. Normal aging involves gradual, mild changes that allow people to adapt and maintain independence. For example, forgetting a word during a conversation but continuing the discussion is typical aging. Dementia, however, brings progressive symptoms that interfere with daily functioning, like struggling to hold any conversation due to word-finding issues. Behaviorally, occasional distraction in a busy setting is normal, but consistent disorientation, like forgetting how to get home, points to dementia. To illustrate, consider memory. Occasionally forgetting a name is aging. Forgetting your grandchild's name repeatedly is dementia. The impact matters too. Aging allows you to function independently, while dementia often requires support. Tracking these differences over time, such as noting when forgetfulness becomes frequent, helps clarify whether changes are concerning. Have you noticed changes in your loved one that seem more severe than typical aging? To make informed observations, use tools to track cognitive changes systematically. A symptom journal is invaluable. Record specific behaviors, their frequency, and context. For example, note, quote, "Mom forgot her doctor's appointment twice this month and seemed confused about the date," end quote. Family observations are also critical. Compare notes with siblings or relatives to identify patterns. You might discover that multiple people have noticed similar changes, like increased confusion during family events. Cognitive checklists like the Alzheimer's Association's 10 warning signs provide a framework to assess symptoms objectively. And technology can help too. Use apps or digital calendars to track missed tasks or memory lapses. For instance, an app might log when your loved one forgets a recurring event. These tools help you build a clear picture over weeks or months, distinguishing between occasional lapses and persistent issues. Start small. Try noting 1 or 2 behaviors this week to see if they reoccur. Sharing concerns with family members can be challenging, but is essential for collaborative advocacy. Start with open, calm communication and focus on specific observations like, quote, "Dad forgot how to use a microwave twice this week," unquote, rather than jumping to conclusions about dementia. Avoid blame or assumptions, as this can create defensiveness. A collaborative approach, like scheduling a family meeting to discuss changes, ensures everyone's perspective is heard. But be prepared for resistance. Your loved one or other family members might downplay symptoms or feel defensive. For example, a sibling might say, quote, "He's just getting older," unquote, but consistent patterns warrant discussion. If resistance persists, suggest tracking symptoms together for a month to gather evidence. Decide who will take the lead in contacting a healthcare provider if needed. These discussions strengthen family support and ensure no one feels alone in addressing concerns. To summarize Lesson 2, normal aging involves mild, manageable changes like occasional forgetfulness, while dementia brings persistent, severe symptoms that disrupt independence. Red flags include consistent memory issues, confusion, and loss of daily functioning. Tools like symptom journals and checklists help track changes objectively, and family discussions foster collaboration. Understanding these differences prevents unnecessary worry or delays in action. Next, we'll explore what increases dementia risk and how to reduce it. Now that we can distinguish normal aging from dementia and have tools to track changes, let's explore what factors increase the risk of cognitive decline and how to address them. Lesson 3 of Module 2 will cover risk factors and prevention strategies, offering practical ways to promote brain health. I'll see you in Lesson 3.